Now, I would like to talk to you about drugs of abuse. Number one, drugs of abuse are drugs used for pleasure. We can basically classify drugs of abuse into three categories. Category number one are what we call positive drugs. The positive drugs of abuse are those ones which they have got therapeutic use. Okay, you can use them to treat some disease. But unfortunately, they also produce some sedation, some excitement, some euphoria, as we call it, pathological happiness, some pleasure. And these drugs, which are meant to treat disease, because of the pleasure they produce as a side effect, they have been abused. These kinds of drugs include some painkillers, the narcotic drugs like morphine, pethidine, codeine, common drugs like Algon, beta pain. Today, their use is restricted because they contain codeine, a narcotic painkiller, a narcotic analgesic, as we call them, that can create addiction and dependence. And then there are cough syrups containing ephedrine. They produce some excitement, some pleasure, and cough syrups have been abused. Then there are sleeping drugs. There are drugs like allergy drugs like Piriton, chlorpheniramine, which also produce some relaxation and sleep. And people have abused these antihistamine compounds because they produce this pleasure and they induce sleep. Okay, so class number one of drugs of abuse are positive drugs. They have therapeutic use, but they also produce some pleasure, and so they get abused. Class number two are negative drugs. Okay, negative drugs. Now, negative drugs are those which are socially acceptable. Okay, they are not forbidden, they are not illegal. They are used commonly, their use is allowed. But nevertheless, they are addictive and they create dependence and they cause disease. Now, drugs of abuse in this category include alcohol. Alcohol is not forbidden in this country. You can drink it, although we regulate the hours of use. Okay. Tobacco, miraa, and may I include also tea and coffee. Okay. So we call them social drugs. Okay. They are used for social occasions, but they get abused. Okay, because they are addictive and create dependence. Then category number three of drugs of abuse are hard drugs. Hard drugs are those drugs that are obviously harmful and by law they are illegal. You're not allowed to grow them, to make them, to use them, to sell them. We are talking about bang. We're talking about heroin. We are talking about mandrax, ecstasy, LSD. It's a long list of hard drugs. So they are harmful. The user himself knows they are harmful and their use is illegal. But nevertheless, because of the pleasure and people would want to hide to use them, they somehow get manufactured, sold, and used. Now, all these three categories of drugs of abuse. The important thing about them is that, let me start with the positive drugs. The positive drugs, what we do with them in the hospitals is that we use the minimal effective dose for the shortest time possible. A drug like diazepam, common name Valium, when now, for example, somebody has lost a beloved one, he is depressed, anxious, one just cannot control himself despite the talk, the counseling, the encouragement, the comfort others are bringing. It is too much for them and they are able to tolerate it. We give them a small dose of these drugs which have got anxiety-laying properties. They allay anxiety and produce peace. And then there are people who have a problem sleeping. So we give them these same drugs to induce them to sleep. Okay? Because of stress, you are unable to sleep for days and it is bad. So we give them. Now, when we use it for these situations, we give them minimal effective dose by a qualified medical professional for the shortest time possible. A drug like anxiolytics, sedative hypnotics like diazepam, we normally limit them to a week or less. Okay? If one requires them to use them for a longer period of time, we recommend that the smallest dose is used and treat the primary cause of the problem using psychotherapy methods, and there are many other methods of treating such problems, anxiety problems and sleep problems. The only situation where we use drugs of abuse freely is like a patient with terminal cancer who has nothing to lose, and cancer can be painful. It is not right that somebody, because you have terminal disease, you should be allowed to suffer excruciating pain. At that stage, we use drugs like morphine, which are addictive. But the patient has nothing to lose, and all we want is to remove the pain so that even if they're dying, they die in peace. They don't die under torture. The negative drugs, including the gums you see chewed around in town by our street boys, including petrol, including some of the cleansing materials, solvents like acetone contained in Q-Tex and other cleansing materials, turpentine and these, cement, repair cements, polystyrene. These solvents, they should not be used. They should not be taken. Okay, and people who use them should be careful because they produce addiction and dependence. Now, the hard drugs goes without saying. Don't even start using them. Okay, so negative drugs, hard drugs, don't even start using them. That's the only cause. When you start using these drugs, they give you pleasure. They produce some pleasure. Okay, you feel happy, relaxed. But that pleasure is, number one, temporary. As time goes, the dose you needed to produce the pleasure has to be increased because the body develops a mechanism of tolerating the abuse. You are taking alcohol, and the alcohol is not food, and your body tries to adjust to get rid of that alcohol. The mechanisms the body uses to try to get rid of the alcohol or tobacco or the solvents, that same mechanisms leads to the body getting used to it, and now when you try to stop using it, you have a problem because the body reacts. So as you continue to use them, you increasingly have to take more. If you started taking alcohol, just a half a glass is enough to make you tipsy. But as time goes, you need a full glass. With time, 2 glasses. With time, several glasses. With time, several bottles. And there are people who can take a whole case of alcohol and they are still walking. They are not yet drunk enough. No wonder they add things like kumikumi, where you add poisons like methanol to make the drink stronger so that they can get drunk. Okay. Now the problem with that is that you are increasingly using things which are not food; they are poisonous. And when you reach those high quantities, now they start hitting the body directly. They chemically hurt the body. Alcohol has a long list of diseases produced by chronic use. Tobacco has a long list of diseases affecting every system of the body, and so on for each of these drugs. They have a long list of diseases. So you start using them for pleasure. With the time you need more. When you need more, when you take more, they cause disease. And when you try to stop, the body reacts. Those reactions we call withdrawal signs and symptoms. And some of those reactions can be so bad they can kill. Delirium tremens, if you've been taking alcohol continuously and you suddenly stop, you suffer from severe alcoholic reaction called delirium tremens. The patient is confused, he's irritated, he is restless, he is sweating, his heart is racing, palpitations, he is weak, his stomach, his abdominal pains, backaches, they can go into coma, have convulsions, and death. Withdrawal from drugs like heroin can be that bad also. Amphetamines, withdrawals from cocaine can be that bad. Any of those drugs, withdrawal reaction can be that bad. In fact, we treat withdrawal reactions with other drugs that allay this, that reduce these adverse drug reactions. But if you are in the house and you've overdosed and you are afraid to go to the hospital, people die and they are brought to the hospital dead. the only thing to do with drugs of abuse. Now, at that stage where you are now used to it, and when you try to stop, you are now suffering reactions, withdrawal reactions, we call that now dependence. Your body is dependent on them. In fact, somebody who has been taking alcohol for long, they can't function properly if they don't drink. They wake up in the morning, the first thing even before breakfast is take alcohol. And they're on their way going to work, they're already smelling alcohol in the morning. And you can see it in their body. They are smelling alcohol, they're having tremors of the hand, they're not steady. And at that stage, you are directly damaging your body, virtually every organ. Alcohol causes so many accidents, causes so many psychosocial problems, causes so many diseases. It is not worth it. The same to tobacco, the same to all these drugs of abuse. They produce pleasure, yes, but then you get hooked to them, addicted to them, you don't want, and then you become dependent on them. It is not worth it. The only safe course with the drugs of abuse is please never start. Once you start, it's just a question of time for you to go down the drain. Instead, we have been cautioned. The Bible has so much to tell us about drugs of abuse. The main drug of abuse the Bible talks about is alcohol. Proverbs 20 verse 1. Alcohol is a mocker. Red wine is raging. Whoever is deceived thereby is not wise. And the book of Galatians 5 verse 19-20 tells us that those who are hooked to drugs of abuse, those who are alcoholics, drunkards, they cannot enter into the kingdom of God. Why? You are damaging yourself, you are damaging others, you are shortening your life, you are creating havoc, you are destroying the very body temple which God has given you to be enjoyed, to be used correctly, to serve Him and to serve others. Thank you. May God bless you.